Welcome back to the Best PT Podcast. This is episode 3.12 talking about neuromuscular pathology. We'll start with Alzheimer's disease. The cause, it's a progressive neurodegenerative disorder due to damage in the cerebral cortex. The neurons responsible for acetylcholine transmission deteriorate and die. Plaques and tangles form within the cerebral cortex. As of right now, there is no actual known cause. Signs and symptoms include difficulty with learning new things, subtle changes in memory and concentration with progressing signs including loss of orientation, word-finding difficulty, poor judgment, rigidity, and bradykinesia. Treatment includes Cognix, Aricept, and Exelon to alleviate cognitive symptoms and control behavioral changes. Eventually, patients will often require admission to a memory care, long-term care unit. Amyotrophic lateral sclerosis, ALS, or Lou Gehrig's disease is a chronic degenerative disease that affects both upper and lower motor neurons due to a loss of anterior horn cells. Demyelination of the corticospinal and cortical bulbar tracts occurs, causing upper motor neuron effects. There is no known cause at this time. Signs and symptoms include asymmetrical muscle weakness, fasciculations, muscle cramps, and a cardinal sign is hand atrophy. Weakness spreads distally greater than proximally. Uncoordinated movement occurs with spasticity, clonus, and a positive Babinski reflex. Treatment mainly consists of supportive care through assistive devices and assistive technology, as well as symptom management. Bell's palsy is a temporary unilateral facial palsy due to trauma resulting in demyelination or axonal degeneration of the facial nerve. It is believed to be caused by a variant of the herpes virus. Signs and symptoms include asymmetrical face drooping, especially of the eyelid and mouth, drooling, eye dryness, and the ability to close eyelids. Symptoms can resolve on their own as soon as 2 weeks. Physical therapists can use direct current to stimulate the facial nerve, as well as use massage and therapeutic exercise to restore facial motion. Carpal tunnel syndrome is caused by peripheral nerve entrapment of the median nerve, most often associated with repetitive overuse, rheumatoid arthritis, diabetes, and wrist sprains or fractures. Signs and symptoms include sensory changes and paresthesia along the median nerve distribution, possibly radiating up the upper extremity to the shoulder and neck. Pain is worse at night and upon first waking in the morning. There is also hand weakness, muscle atrophy, decreased grip strength, and decreased wrist range of motion. Treatment includes splinting, ergonomic assessments, corticosteroid injections, and a surgical release may be indicated. Cerebellar disorders, a few different types. Congenital malformations manifest early in life but are non-progressive. Hereditary ataxia or Friedreich's ataxia involves gait unsteadiness that begins early in life, progressing to upper extremity ataxia, dysarthria, and paresis. Mental function declines and tremors occur. Spinocerebellar ataxia involves neuropathy, ataxia, and restless leg syndrome. Acquired ataxia is usually due to toxin exposure. It can also be idiopathic. This type of ataxia is most often reversible. Signs and symptoms include ataxia. Treatment. The diagnosis depends on what type of cerebellar disorder is involved, and treatment is usually supportive in nature unless it is an acquired reversible condition. Diabetic neuropathy is caused by nerve ischemia due to microvascular changes secondary to hyperglycemia. The most common presentation is symmetrical polyneuropathy and autonomic neuropathy. Signs and symptoms include a stocking glove sensory impairment pattern, muscle wasting of the hands and feet, radiculopathy, especially in the feet, urinary impairments, kidney failure, and diabetic blindness. The most effective treatment is to lower your blood sugar by exercising. Epilepsy is caused by a temporary discharge of cortical neurons, or seizures. Signs and symptoms include a loss of consciousness or awareness, movement disturbances, sensory impairments, and mood or mental changes. Treatment is mainly focused on anti-epileptic medication. Guillain-Barre syndrome, or acute polyneuropathy, is a temporary inflammation and demyelination of peripheral nerves resulting in possible axon degeneration. The actual cause is unknown. Signs and symptoms: motor weakness presents in a distal to proximal fashion with sensation impairment and possible respiratory paralysis. Guillain-Barre syndromes peak 2 to 4 weeks after initial onset. Treatment usually involves hospitalization due to respiratory paralysis, followed by physical therapy. Huntington's disease is caused by a genetic defect resulting in degeneration and atrophy of the basal ganglia and cerebral cortex. Signs and symptoms include involuntary chorea movements, personality changes, grimacing, tongue protrusions, and ataxia. Later stage Huntington's symptoms include mental deterioration, a decrease in intelligence, depression, dysphagia, incontinence, and finally immobility or rigidity. Treatment is focused on pharmacological management. Physical therapists should focus on maximizing strength, range of motion, and function before deterioration begins. Multiple sclerosis is caused by patches of demyelination of the nerves of the central nervous system. The actual cause is unknown. Signs and symptoms include visual problems, paresthesias, sensation changes, clumsiness, weakness, ataxia, balance impairment, fatigue, and sensitivity to heat. Those last two are big for physical therapy: fatigue and sensitivity to heat. Treatment includes lessening exacerbations through pharmacological management and maximizing health and function with physical therapy. Myasthenia gravis, an autoimmune disease causing damage to the neuromuscular junction. Acetylcholine receptors are destroyed, thus preventing muscle contraction. Signs and symptoms include extreme fatigability and skeletal muscle weakness. Ocular muscles are usually affected first. Over half of myasthenia gravis patients have ptosis or diplopia. Treatment: some patients require ventilators. It's called a myasthenia gravis crisis. Anticholinesterase drugs may be utilized, and physical therapy should focus on energy conservation and strengthening through isometric exercise. Parkinson's disease. The cause is degenerative disorder due to a decrease in dopamine production by the basal ganglia. Signs and symptoms: a resting pill rolling tremor, fascinating gait, balance impairment, difficulty with fine motor control, akinesia or bradykinesia, cogwheel or lead pipe rigidity, and a flat affect or Parkinson's mask. Treatment for Parkinson's: dopamine replacement therapy. Physical therapy treatment should include large amplitude movement therapy such as LSVT-BIG or PWR to focus on range of motion, strength, and endurance. Post-Polio Syndrome occurs in 25 to 50% of people affected by polio, approximately 25 years after their initial polio infection. The mechanism here is that compensatory nerve innervation of previously denervated muscles fails and muscle denervation returns. Signs and symptoms are a slow and progressive weakness, fatigue, muscle atrophy, pain, and dysphagia. Treatment is lifestyle modification. That's it for Neuromuscular Pathology. Episode 3.13 will talk about cerebrovascular accidents or stroke. As always, the outline will be in the show notes. Thank you for joining.